Hi, everyone. Good afternoon. I think we can get started. I'm Lauren Volanovic. I'm a communications specialist at the Pan American Health Organization in Washington, D.C. And it's a pleasure to be connected with you all today to launch one of our tools to strengthen ESAVI or AEFI global and regional surveillance, specifically on crisis communication as it's related to vaccine safety. So we have a great panel for you all today, and we will get started in just a minute. I just wanted to let you know a few housekeeping rules that if you have any questions, you can feel free to put them at the bottom of the screen. There's a little Q&A box, so please feel free to write them there throughout the session as you have any questions. We'll also be monitoring the chat, but please do use the Q&A for questions. We will be recording this session, and we will share the recording as well as the links to the resources that are mentioned during the session and the links to the presentations following the session. So you will be getting that all as long as you have registered for the event. So now I am happy to give the floor to Dr. Cuauhtemoc Ruiz, the Unit Chief for the Immunizations Program at PAHO, to give the opening remarks. Thank you so much.
Hi, hello, thank you. Thank you, Lauren, for the presentation. Good afternoon and welcome everyone for this webinar that we have to launch a new material that is the crisis communication related to vaccine safety, the technical guidelines. Give me a chance to present. I am Cuauhtemoc Ruiz Matus. I am the head of the immunization program here in PAHO. As you know, we need to be ready for and to be prepared properly to respond to any vaccine-related crisis that we have at any time. But now it's absolutely critical to be ready with this in the introduction of new vaccines. In general, in the introduction of any vaccine, like we have with the HPV vaccine or we have with the pneumococcal vaccine. But now that we are in the preparation for the introduction of the new vaccine against COVID-19, it's important not only to be prepared with the vaccine, not only to be prepared with the human resources, we need to be ready to prepare for to prevent or to respond any crisis about the vaccine related with this new vaccine. Now, this point of the preparation about any adverse event following immunization, that is the AEFI in the English, it's important because all the countries that we are participating in the COVAX facility to receive vaccines against the COVID-19, one of the plan that the countries, one part of the plan that the countries need to present is this risk communication plan. It's important that all the countries are working in this. And in this moment, a lot of questions and rumors about the COVID vaccine. It's in the news, it's in the population, and it's because all the people are talking about for these vaccines. Maybe the time for the evolution and the research in the vaccines it's shorter in comparison with regular time for other vaccines. But it's necessary that to give information to the population that we maintain the criteria of the safety and effectiveness of these vaccines. The second point is that there are a lot of rumors about that this vaccine is good or not, that the vaccine protect or not, or is a risk. And we need to be prepared with solid crisis communication plan to maintain of strengthening the population trust in the immunization programs and vaccination in general, not that we are doing for a long time. The immunization program in the America region is one of the most important programs that we have. The trust in the population, it's important to maintain this in this moment. It's important to know if we have some crisis related with the introduction of this new vaccine, COVID-19 vaccine, is going to affect not only the COVID-19 vaccine program, it's going to affect the immunization program in general. And it's necessary to be clear what is the mechanism, what is the the preparation that we need to have with the countries. This is the reason that we are very happy here with you to have this opportunity to participate in this webinar. Some of you live now or other watching the recording, because it's important that together work with this. Your role in this, your role in the implementation, your role in the communication with the population, it's really important with this. It's important that the communities, the people need to be involved in this, and we need to be very clear in the response. Be honest to base in the evidence that we have about the vaccine and to give the information that the people request. There are people that it's a technical people or people that is working in the health service, but the general population have a lot of requests of information, and it's important that we work in this plan. With this, thank you again to be in this session. It's a pleasure to come with you can to come with all the team to support you in your work on these important topics. Thank you very much to be here, and give me a chance to introduce to Maria Paz that she's going to take the next point for the agenda. Please, Maria
Thanks
Paz.
so much. Thanks so much, Dr. Ruiz. I'm very happy to be here also. I'm going to have the honor to make the first presentation of this crisis communication related to vaccine safety. This is the presentation that's going to talk about the general features of the crisis communication and also the preparation phase. That is the first phase. After, my partner, Catarina Sofia Dolezal, is going to talk about the implementation phase that is going to be seen next to these slides. Well, first we're going to talk about the presentation objectives, and we're going to talk about some of the known determinants of communication. Then we're going to talk about the importance of listening, but also on monitoring, because it's not all about talking to the people, but also listening them back and adjusting the messages according to them. Then we're going to talk about some identifying actions and the key actors that we need to know. Also, how to engage in dialogue to strengthen the trust in vaccines and vaccination. And finally, we're going to share some practical tips to you and your teams. So there's 4 pillars in the vaccine crisis management. These are the communication goals that we want to share with you. We're going to talk very short about these topics, but in the guidelines, you can read and you can review all these interesting topics on your own time. So these are the 4 main communication goals that we want to share with you. First, in this vaccine crisis management, we're going to be focused on help maintaining and strengthening the trust in vaccines and vaccination. But also we have to build the dialogue, and this dialogue must be bidirectional. It's not only talking, but also listening to the public. Then we have to see that this crisis about communication safety, there are also some opportunities to improve internal processes, but also to consider the lessons learned to be implemented in the next phases. We also need to say that all these materials have to be adapted to the local determinants because they are very context dependent. So these are the 5 key actions from the preparation phase. First one, we have to get to know the evidence, and this means that we have to understand which are the determinants of communications. And also we have to monitor the public perceptions about risk and risk communication and how they perceive the risk. Then we have to engage with the key actors. First, we have to identify them, which one of them are collaborators or which one of them are also maybe obstructionists. Then we have to create a list of these stakeholders. All of this in the preparation phase. Then we also have to have some some establishing the response mechanisms. And this is made through training, but also to the preparation of messages before a crisis is set. Then we have to inform the public in this preparation phase before a crisis happens. And we have to inform them, to the public, to build the resilience. This is the raise of awareness about the benefits and the risk related to immunization and the vaccine preventable diseases. And lastly, we have to monitor and evaluate the answer of the public. This is mainly due because we have to understand the event that is happening. We have to classify it, and then we have to identify and design the proper communication response. So first, we have to understand which are the determinants of the communication. And when we talk about vaccine acceptance, we also talk about the vaccine hesitancy spectrum. When we talk about the hesitancy of the vaccines, we have to know that this is not a yes or no question or answer. This is a spectrum, and people can transit among these according to their context and according to which time they are living, or different elements that the people are living. So on one of the parts of the spectrum, we have all the people that accept or actively accept vaccines. They look forward to. In the middle of the spectrum, we can find the people that can accept some of the vaccines, or maybe they delay some of them, they accept another ones. And people can transit among this spectrum. And on the other side, on the side of the rejection of the vaccines, we can find some very small group of people that can reject all of the vaccines. And as I said, people can transit on their lives among this spectrum. We have to understand that, because that's how we can manage also the type of messages that they need to hear. Now we talk about some of the risk perception and the decision to vaccinate. So here are some of the factors that can affect the individual risk perception. Here on the left, we can see that if a person has a higher level of risk related to the disease that the vaccines is helping to avoid, that person probably is going to accept the vaccine themselves or their child. But on the other hand, if a person has a very high level of risk related to the vaccine or the adverse events, there's a very big probability that that person is not going to accept that vaccine. So we have to learn how this risk perception is built. And we would like to think that this risk perception is built only based on facts or only solely based on scientific evidence, but that's not the case. We actually build this risk perception based on very emotional facts or very emotional aspects of life. There are some biases that we have to consider, like the affective heuristic or some affective biases. And this means that we tend to be guided by emotions. Our emotions alert us from potential risks. There's also the safety effect. This means that we tend to focus more on the losses than the gains. This is a very important bias that we are very vulnerable. It's the confirmation bias. And we are more likely to trust the messages that support our own conclusions. Then there's the availability heuristic, that meaning that we make decisions based on facts that come to mind immediately, forgetting the distant ones, even though those facts could be correct. And lastly, there's the anchoring heuristic or bias, that we tend to base our decisions on familiar opinions. So we have to bear this in mind when we design the messages for the population. Also, we among all of here, probably we are very technical, we are health professionals, and we build our risk perception based on the information, on scientific evidence, on the training, like this one that we have received, but also on the investigation evaluation of causality of events. But there's a gap. between us and the general population and how they build this risk perception, because mainly that risk perception in the general population is built from different sources, from information that they receive, but also on emotions and experiences, and also in these biases or heuristic that we just say. So that's important also to bear in mind. And what happens when this gap affects not only the general population, but also the health workers? We have seen in this pandemic that some of the health workers could be susceptible to this hesitancy, not only from COVID vaccines, but from other vaccines as well. So we have to know how to optimize the communications with the health workers. And here are some tips of what we can do to talk to them and to build this resilience. So first, we have to empower them in decision making. And this meaning that we have to avoid criticizing the hesitancy, but we have to focus the intervention on the empowerment through knowledge. Second, we have to talk about the collective benefits. We have to provide them information about their rights of being protected from this disease, but also about the collective duty that vaccines have. Then we have to highlight the risks that are associated with the vaccine rejection. We know in 2019, the World Health Organization tells us that the vaccine hesitancy is one of the main challenges in public health that we have to address. So that's important to talk about when we talk about health workers. Then we have to talk about the minimal risk associated with vaccination. We have to be transparent in acknowledging that these facts and these adverse events happen, but that we have to tell them in the proper context. We have to talk about the evidence. This is how we show commitment to vaccination. And we have to have some assessment tools. We have to measure or use some screening tools to detect vaccine hesitancy among health workers. Lastly, we have to design some positive messages that will create these messages targeting specifically to health workers. And how we can monitor this risk perception or the perceptions about safety among the community. These are some methodological aspects that we want to share with you. First, you and your team has to get some clear objectives about what you want to measure about perception. You have to know which public you're going to measure this risk perception or the safety about vaccine safety. You have to define the public. It's going to be the general public, it's going to be the health workers or some of the other groups. We have to know how much it's going to cost to do these investigations or this research. What about the feasibility? We have to know how much time our team has, and this is going to be very closely related to the methodology that we're going to use. We have to know if this is going to be accepted by the community that we're going to measure this in them. And of course, this is very important. We have to bear in mind the ethics aspect of the research if we're going to do the research in the community. We have to validate the tools that we're going to use or the messages that we're going to use. And lastly, we have to reflect, we have to know how we're going to present these results to the community. About the research and monitoring tools that we have, I was just talking, these are some examples of available tools in the guidelines. You're going to find much more information about this, but I'm going to just name a few. First, you can review the press summaries, and these are the daily press summaries that we can gather. They are non-exhaustive, but you can review what the press is talking about, about the vaccines or the vaccine safety. We can do our own opinion polls or our questionnaires, like I said just now. And we can design our own scientific research. There's a lot of methodologies, quantitative or qualitative, that we can use to gather information from the community. But it's very costly, and we need some personnel that is trained on this. We can do rumor monitoring. We do this a lot in epidemiology. This is highly sensitive, but it's time consuming. And some of the times we gather some signals that are very low in impact. We can do also social media monitoring to know what people are talking about online on our social media. And lastly, we can go to our health workers to gather information among health workers. Is low cost because there is already existing capacity, but we have to bear in mind that could be a perception a little distort or could distort perception because that's not how the general public think or perceive the risks. How can we work with the key actors? First, we have to know who they are. So these are some questions to identify the key actors to build these teams. First, we can ask ourselves who can be a very important supporter. So there's already an ally there. Then we have to ask ourselves which are the sources that people use that are most reliable sources of information. So we have to be there because that's where people are gathering the information. Next, we have to ask ourselves which are the focal points, meaning who needs to be informed in the case of a vaccine-related crisis. Then, what are the questions, meaning that who might the media want to ask those questions? Then we have to talk about the consequences of this plan. Who could be adversely affected and who could benefit from providing support in this plan? And lastly, this is very important also, apart from the supporters, we have to identify which of the persons in our community could become some obstacles, who could be an opposition force, and what are the targets or the strategies to dialogue with them. Now I'm going to talk to you this is a slide about the coordination mechanism. So you can establish an internal coordination mechanism of the team. First, you have to train the personnel. That includes the spokespersons and the health workers representatives, which are members of the community group. And of course, we have to prepare the messages before the crisis established. This is the preparation phase is the best time to design and share among the members some messages that you can use them when the crisis happens. We have to understand the media. The media is our natural partner when we have a communication crisis. So we have to understand how the media works. We also have to inform the public and build this resiliency. We have to raise awareness and we have to build knowledge based on the evidence. Lastly, we have to monitor and evaluate how this plan works and if we have to adapt it. These are some of the key trust building elements. We're going to find them in the guidelines. I'm going to just name them. First is the competence. We have to demonstrate the knowledge to manage the crisis. We have to be very objective, transparent. Transparency is very important in communication, especially in vaccine safety. We have to be inclusive and very consistent among everyone in the crisis communication team must be very aligned, and we have to demonstrate this empathy, not only facts, not only evidence, but also empathy and effectiveness. I was talking about understanding the media. This is very important. We have to know how they function because they are our natural partners to dialogue with the public. We have to know what factors cause that a fact can be considered newsworthy. We have to know the communication codes of the media. And finally, we have to know which are the objectives in a communication crisis. What are the media looking for in a crisis? They're looking for timely information, the official positions, also the messages that are very appealing to the public, but they also want to know if they can clarify some of the rumors. And if a mistake happened, they want to correct that mistake and give the opportunity also to follow that line of questions. So the media, we have a lot of media in the guidelines. You're going to find more information, but here I just brought some examples on what are the differences among them. We know that television has a high coverage. We also know that has a very high impact on people. And also we have to know that on television, it's not only what we say, but how we say it. Body language is very important. So we have to train spokespersons on body language and how you can transmit to people among that. Radio is very immediate. We have to also know that it's very broad in the reach, is low cost, and is very interactive. Maybe we have to be careful in radio that almost always the programs are live, so you don't get to go back to try to do it again. And written press is very important to in-depth reports and some analytical articles. And maybe the bad part of the editorial press is that we don't get a saying in the final editing most of the time. And social media, of course, a very important part of media in this day and age. So Facebook, Twitter, but also Instagram, TikTok now, and every other social media is going to be very important when we design where and how are we going to communicate with the public. Lastly, this is not a media, but this is a repository of validated study, the Vaccine Safety Net is a repository, as I said, of sites about vaccine safety made by the World Health Organization, and we invite you to get to know that too. So what's the process for responding to an event? This is the summary of the process for an adequate response in a crisis communication about vaccine safety. First, we have to understand the event. I'm going to talk about that next. Then we have to classify the event. This could be three broad types of events. I'm going to name them now. The third step, we have to classify the impact. We have to know which type of impact it's going to have. And according to that, the communication response. Not every event has to have a broad answer or a broad response. We're going to talk about now about that. First event that I'm going to talk about is the ESAVI, or the event that is supposedly associated with vaccination or an immunization. The definition here is that any unexpected health situation that happens after a vaccination that is unfavorable or an unintentional symptom. The impact can be very low if it's not a not serious event or not relevant to our context. This could be something that happened in another country, on another continent. Could be medium if it's serious but relevant, and could be high if it's serious, unknown, and generates a lot of media attention. What are the key actions in this type of event? First, the preparation. Be prepared because it's mainly going to happen. So you have to have some messages already designed, and you have to have the spokespeople, preferably that they have received some training. You have to expect the anxiety and the public insecurity. This is very natural and it's going to happen. We have to be very transparent in how we communicate this with the audience, and we have to monitor what happens when we talk with the people. Secondly, the second event that could happen is what happens during a campaign or during some changes in the national immunization program. This could be the introduction of a new vaccine or the replacing a vaccine, maybe a suspension or a temporary recall. All of this can generate, and it's going to generate, probably a response in the community that might generate a crisis in the communication area. So the impacts also can be low if there's a small change that doesn't generate any traction in the media. Medium if there's a vaccine replacement, for example, with no or very little public attention. And high if it's a very negative media coverage or develops some public concerns or the reasons aren't understood by the audience. So which are the key actions in this type of event? First, carefully explain the reasons for the changes. If there's a suspension or a temporary withdrawal, we have to clarify that it is a precaution measure. So these are some of the key actions that we are sharing with you. Lastly, if we have an event where there's a publication that's very critical about vaccines or a debate on vaccination, this could be a scientific publication, unconfirmed rumors, maybe personal stories on social media, or critical articles could generate also a necessary response in the communication area. So the impacts also could be low, and when there's an event that doesn't generate any attention. Medium, if it generates some public attention, but promotes some concerns and fears. And high impact, if there's a significant attention and triggers fears in a large audience, for example. So which are the key actions in this case? First, we have to acknowledge that debates are common. We have to evaluate if really there is a response that is needed. And second, that unreliable scientific research are not infrequent, so they often do not generate public reactions. And lastly, very important, we have to remember that this response must consider the risk perception gap and the emotional aspects. This is how we said at the beginning of the presentation. And with this, I'm going to finish my presentation with this last slide, that is with what is the main objective on communicating the public on a crisis related to vaccines. You have to be prepared to this crisis because it will happen sometime. And a crisis can harm the public trust on vaccines and on vaccination. So the main communication objective in a crisis related to vaccine safety is to build, keep, or rebuild this trust on the importance of vaccines and the benefits of vaccination and immunization. So with this, I'm going to go to our first exercise that we have today to share with you. We're going to present a case, and then we're going to ask you some questions about this case. But first, I'm going to ask my partner, Katarina, if there's some questions that we can answer now before we go to the next phase.
Thank you so much, Maria Paz. And maybe as it's the first time that I'm taking the floor, I can quickly introduce myself. My name is Katerina Sofia Dolleschal, and I worked as a co-author of this manual, this vaccine crisis communication manual. I saw one interesting question in the chat that I see that Lauren's currently answering, but I think Maria Paz, maybe we can say a few words about this. And it's really about using key social leaders as champions for vaccination, for health workers, using a respected health worker that accepts vaccination, same for other target groups in society. I have a few thoughts about that. Maria Paz, would you like to go ahead, or would you like me to start?
No, please, I've talked too much, so go ahead.
Thank you so much for your great presentation. I think, you know, there's sort of two elements to this question that I'd like to briefly address. And I think one is actually stated in the question itself, and it's, you know, about using trusted health workers and sort of trusted champions. And I think the word trust here is extremely important. And as Maria Paz also highlighted, you know, when we communicate about such a sensitive topic or about, you know, vaccine safety, I think what's important there is to use spokespersons and communicators and messengers of these, you know, overall messages that are really trusted by the population, but that are specifically trusted by the target groups, those that we want to target with our communication. And I think, you know, we'll speak about it a bit more today, and Maria Paz really, you know, highlighted that, but it's really about tailoring our communication strategies and tailoring the messages that we disseminate in order not to, you know, send generic messages out and really have this sort of, you know, monodirectional communication approach, but really this bi-directional approach where we try to conduct social listening, where we try to look at, you know, what do people actually think, what's, you know, their opinion on vaccination, what's their preoccupation, what are their questions, where does the uncertainty come from, and then really based on these behavioral insights, create strategies that are tailored for various different groups. And that also brings me to the second element that I wanted to raise with this question, which is really target groups and prioritize groups. And I think specifically when we look at, you know, the introduction of COVID-19 vaccines, priority groups are of such importance, not only for, you know, having access to the vaccine and for receiving the vaccine, but also when it comes to the communication element of our strategies. Because I think it's really important that we don't just, you know, target the entire population with our communication strategies in terms of COVID-19, but really try to explain to people why there is a prioritization, why some people are at higher risk of, severe COVID infection as well as death, and why in order to get back to normal and in order to also, really sort of end this acute phase of the pandemic, that we have to start with the people that are most at risk, and that we have to do everything to ensure equitable and fair access to vaccination for these groups. So that's just very quickly something that I wanted to highlight with this question.
Thanks, Katarina. I'm totally agreeing with you now. So we're going to try to be very respectful with the time that we say we're going to respect this agenda. So now we're going to go with this small exercise that we're going to present with you a case, and then we're going to ask you that you can answer some questions about it. So this is a case study. So this happens in this scenario. The scenario of a COVID-19 vaccine introduction in a country A, some country. So during a vaccination campaign to vaccinate health workers in a country, you receive a report that a health worker has died just a few days after receiving his COVID-19 jab. What are the case descriptions? You have a male patient that at the time of death had 64 years. He was a nurse. The comorbidities that he presented, he had hypertension, he had experienced a myocardial infarction 6 months ago, and the response mechanism that you are a part of the National Communication Task Force on COVID-19. So what happens is this: you have breaking news, you have newspapers, and you have every press talking about this in your country. So there's a media cover that says in this newspaper that a nurse died after being vaccinated. And it says that the community is in shock. They woke up and they find out that some of their members had died in the last hours, and that a health professional would have been vaccinated a few days ago. So you find out as a team that you have to deal with this communication case. Well, after a few hours, there's more context of the case. Two hours after having received the first report, you have a second report, and you receive a second report regarding another death of another person following COVID-19 vaccination. This time is a 90-year-old resident of a long-term care facility that has passed away. What are the vaccination aspects about this case? It does. Both persons had received the same vaccine product from the same batch, however, in two different vaccination spots. What are the impacts of this case? You receive these messages expressing concern, and you are very worried that these events will have an impact on the current mass immunization campaign, as well as potentially routine immunizations. So these are the two histories that you receive on this report. First, a 64-year-old health worker with a history of hypertension and uncontrolled diabetes experiences a myocardial infarction 6 months ago. Second, an elderly man and resident in a long-term care facility of 90 years old and multiple comorbidities, and at the time of vaccination, he presented with symptoms of pneumonia. So now I'm going to ask you that you can answer some of these questions together. Fernando, if you do me the honor. You can find now some questions that we invite you to answer in your screen. First, we are going to ask you what type of an event we are facing. And you can use this algorithm of the steps that we mentioned. Is this an ESAVI? Is this a mass vaccination campaign? Or is this a change in the immunization program? Or is this a public debate or a critical publication? Second, what impact level are we facing? Is this a low impact event, a medium, or a high impact event? Then, which actions would you implement? And you can see here that you have a multiple option. You can point everyone, all of the options that you think they are right. First, if you use the messages that you have prepared in the preparedness phase and the prepared spokesperson. Second, be ready to respond to the public concerns. Third, be transparent in your communication and communicate with the public about what you know. And last, monitor both public opinion and how the public reacts to your communication response. So we're going to wait for a few seconds to know what your opinions are on this case. So Nando, you can tell us when you think it's going to be over.
Yes, Maria Paz, it's about 21 responses out of 76 participants.
Oh, let's wait a little while. Maybe 30 seconds more. I think we can already see a trend here in the answers. I think we can close now the poll, so you can all see the answers that you have provided us, and it's very interesting. The first question, actually, we expect this to happen because this case is about these three events. We have an ESAVI, we have a person that have an event after a vaccination. We have a campaign, a COVID-19 campaign, and we have a public debate. So we know these three can coexist. Then the impact. We mainly expected that all of you said that the impact was high because we know in the community when a person dies related to a vaccine introduction or vaccine use, it's going to have a high impact. And also we have vulnerable people involved, like health workers, and also, a person of 90 years old. And lastly, all of these options were correct. So we're very happy to see this is what you have answered. So thank you very much for your participation. This is very important to us. So we thank you for your motivation. And now I'm going to give the floor to my colleague, Katarina, that is going to share with us the second phase in the response in the crisis. Thank you, Kata.
Thank you so much, Maria Paz. And before, starting, let me thank all of you on the call for making it, for 1.5 hours in your busy schedules. We're very much aware how busy all of you are, but we really hope that these materials will be useful for everyone working in countries at the moment. Thank you, Maria Paz. Next slide, please. Before starting and talking a bit and taking you through the response phase or the implementation phase, I really want to say something that I think is very important, and I think we should see these different phases of crisis communication, the preparedness phase, the response phase, and the evaluation phase, very much as mutually reinforcing phases. The stronger the preparedness phase, the stronger the response phase. The stronger the response phase, the more we can actually try to evaluate, the more we can learn from lessons learned and from past experiences, and the better we can then prepare the next preparedness phase, because as we know, crises are very often around the corner, or at least events that may ultimately evolve into a crisis. So what are the main objectives of this part of the presentation? It's really to highlight some of the key actions that we deem very necessary for this preparedness phase, and that help governments and health authorities, countries as a whole, really to create an effective response to an event that may lead to a crisis or a crisis itself. Secondly, we want to look a bit at the key trust building mechanisms and elements, again, that Maria Paz has already mentioned. I think this is really important to mention and display and integrate into presentations as much as possible, because we talk about confidence and trust in vaccination and in health authorities and in immunization systems a lot, but what does it actually mean? What are the actions that we have to take in order for us to then also convey these trust building elements? And then lastly, we will just very quickly look at some key messages in regard to COVID-19 vaccine introduction and rollout. Next slide, please. So really, and I touched upon it very quickly, but really the main, message, I think, for this entire presentation is that trust is so important. We know that trusted people have, a larger impact, a stronger impact on changing behavior, on making people go, a certain way, lean a certain way, and really conveying the facts as well, that we very much obviously try to do as part of our work. Next slide, please. Here you can see the index or table that you also find in the crisis communication manual, and I just really quickly wanted to display it here and just to show again, this mutually reinforcing nature of the 3 different phases, and just to say again that we'll look now at the second phase, and you can also see it's kind of structured according to different action points, and it's meant also a bit as a step-by-step guidance to be very operational, to be very practical, and also highlighted with or accompanied with by actually various links to more resources. So it also functions a bit as a sort of document repository of what other and additional and further guidance is available. Next slide, please. So what are these, what's the step-by-step guidance when it comes to responding to a crisis? And I just really quickly wanted to highlight 4 different action points here. The first one being to coordinate and commit. This is really about, stakeholder engagement and activating the stakeholder mechanism that we created in the preparedness phase. Then we want to look at how do we then actually work with these stakeholders to create a communication and a response plan. How do we then share information? When is it a good time to start sharing information externally? And then we also want to look just a bit at, monitoring not only the response, but really public opinion. I think this is very important to keep in mind that this is something, monitoring public opinion and engaging in social listening is really something that we should keep in mind all the time, not just during a crisis, but also beforehand, to better understand, as Maria Paz said, also what communities think, what their perceptions are, what's their knowledge, what's their practice, and based on that, we can then always tailor and create adequate communication responses and strategies. Next slide, please. So let's look at each of the action points very briefly. First of all, we want to really, coordinate and commit. So hopefully in the preparedness phase, we've already created a mechanism where we have different stakeholders that are involved. And I saw a question in the chat also, or I think it actually got to us before the webinar, sort of asking about, the involvement of community leaders and of community-based organizations. And I think that's really an excellent point. And we should keep in mind that this mechanism should be quite broad. It shouldn't just be limited to the government itself. It should really try to include also, communication focal points, technical focal points, obviously, maybe even journalists, the media, to really try to have the strong network of stakeholders that are all working, on the same agenda, on the same project, with the same communication goal in mind, so that when a crisis happens, we can immediately activate that stakeholder network. And we've also seen, crises that have been managed well, that the actual stakeholder collaboration and the network at the country level between different stakeholders from various backgrounds working together is really quite crucial. And in this step, it's really about activating that group, trying to find and define some kind of mechanism of sharing information. And obviously, if you're involved in this group, you will also receive information and be updated at the same time. So it's really also about this, two-way communication. Next slide, please. And then what I actually also wanted to say regarding stakeholders, what I find is quite important is that the mechanism that you create in the preparedness phase should be quite large. But then when you have identified what kind of event you're facing and you're sort of starting to try to think about a communication response or a response, as a whole, then you can sort of limit the stakeholder group to really those that may be, most benefit and advantage for this specific group. And this obviously varies from crisis to crisis, as every crisis is unique and really deserves, a tailored response. So when we now go into the second action point, we really want to look at who are the key audiences that our communication response or response as a whole shall tackle, shall target. Who are the people that are actually most affected at, what's happening at the moment? Then who are people that could have really a direct influence? And here again, I want to take up the issue of community leaders, of community-based organizations, of trusted people in that community. Who are those? So here is really important to take some time to really try to map and match all of these different audiences. And then maybe even, as a third step, who are influencers or people that may have sort of an indirect influence at a bit of a higher level, not the direct level, but a bit of a higher level. So it's important really to have this holistic approach in mind when identifying key audiences. And then we want to define the communication goal. What is the overall goal? What do we want to achieve? What's the crisis about? What's the ultimate sort of solution to the crisis? Where are we headed at? And that should usually be one communication goal. And then below that, you have various kinds of objectives that could also, refer to different target audiences, etc. That's then a bit going into the nitty-gritties, but it's really about having that idea of what do we actually want to say and whom do we target. Again, tailoring and adapting messages, really important, specifically in the COVID-19 pandemic. We've seen so much talk about social listening, about really conducting behavioral insight studies, looking at what people think, what are their opinions, what are their preoccupations, what are their concerns, what are their, really what are they thinking about, what sort of we are doing at the other end. And then based on identifying the stakeholders, knowing what the overall communication goal is and what the objectives are, then we can, adapt and tailor the messages that we may have already created in the previous phase and really try to mold the language so it better fits, the needs really of the audiences, what they want to hear. And here it's important, I think, to really look at the language, with certain population groups, you may want to not go into too much technical details, but there are actually other, population groups, specifically now with, COVID-19 vaccine introduction, like healthcare workers that understand technical language. And there we also shouldn't be, too far away from technicalities. And then we want to, as a last step, and I also want to say these steps are obviously, presented one after the other, but they're really intertwined and can happen at the same time and together. So it's just for the purposes of the presentation and the manual. And then really, choosing the communication channels. What are my audiences? What are the, channels they may be easiest to reach through? Is that the radio, is it television, social media? I mean, we've heard a lot from Maria Paz about the different digital tools and communication tools available in general. And I think here it's important to segment that as well. I mean, if we think about residents in long-term care facilities, for example, it would probably not be Facebook or social media, but rather maybe flyers, brochures, the radio, television, or more traditional channels. So again, something to keep in mind. Next slide, please. Then it's about sharing information. And really, I don't believe there's the perfect moment to share information. I think really in each crisis, because each crisis is so unique, an analysis has to be sort of conducted prior to sharing information. But I think what is important also is to keep in mind that, we don't always know everything, and it is okay to be transparent and to share that not everything is known yet, that we're still waiting for information to come, but that we reassure the population that we're doing everything to keep them updated. And as soon as we have the the needed information, we will share it with them. So I think regular information sharing to build that trust, to maintain that trust, is really, I think, quite important there. And I think this is also where you can, bring the stakeholder management in again, having, various stakeholders in their group that may have different trusted audiences or different manners and possibilities to reach out to people. That's why it's also important to have a bit of a broader stakeholder, network there, so you can really try to cater to different people's needs with different people that are available in this network. When you prepare a spokesperson, I believe we talked about that already, also in Maria Paz's presentation, but it's really to make sure that they're trained, that they're not only trained in communication, but also, if possible, in vaccine-related issues, specifically now. And then it's important to, when you prepare the spokesperson or spokespersons, that those, as I said, are trusted people by the community that you would like to reach, and that you also, before signing up to interview, for example, that you make sure that you know what the agenda is, who's the journalist that will interview the person, etc. In regard to tricky sort of interviews, in one of the guidelines that we worked on together with Maria Paz at PAHO, that looks at the interpersonal communication between healthcare workers and people, we also look at different ways that, and actually it's also in this manual, we look at different bridging methods and different methodologies that spokespersons can use to effectively maintain the trust in the audience that will listen to the TV interview, etc. So there's a few tips and tricks for journalists also in an annex of the manual. And then again, when also the spokesperson informs the public, I think I said it before, it's really important again that this is really based on evidence, that this is based on insights and based on really community insights, that we know how they will react. And then lastly, also, that's why it's also always of great help to include journalists in that, coordination mechanism, because you can then use trusted journalists at this stage when you're already facing a crisis. That will be of enormous help, because you can trust them, and you can then, they help you amplify the platform of, coordination and dissemination of trusted information. And that's why also sort of the regular, contact with journalists is quite important, and the media. Next slide, please. And then lastly, it's really, I just really quickly want to go into some of the action points here, when it comes to monitoring public opinion and the response. So there's these two things about monitoring. On the one hand, we want to monitor the response, we want to see what's going on. And here again, I think that, having this stakeholder network can help, because they can help, look at lessons learned and experiences, and kind of help evaluate also the response that you're currently trying to implement. And then again, to monitor public opinion. And I don't want to go too much into the tools that are available to monitor public opinion and conduct social listening. There's quite, a large area of different tools available. There is also in the manual a section dedicated to how to monitor public opinion, and both, cost effective and more sophisticated, let's say, tools and ways to do that. Next slide, please. Now, as said before, I just very quickly wanted to go into, building trust during a crisis. We already talked about this briefly. Next slide, please. And really just, it serves a bit as, the key actions in a nutshell, but what kind of, trust building elements are actually intertwined in these actions, and what are the elements that you actually want to, convey through this approach. And it's really, activating your stakeholders. It also shows the population that you're able to work together, and that you're also able to speak with one voice. I think this is really quite crucial, that when you're in a crisis and then the population perceives, if the messages are very consistent, and not sort of, mixed. And you have the feeling that the people, leading the response actually communicate with one single voice. This is really extremely crucial and shows, professionalism and also empathy toward the population. Secondly, responding immediately, and I don't want to say that we have to inform and respond immediately publicly. I mean responding immediately also in terms of, gathering your stakeholder group, activating them, and really trying to gather or create a response to the crisis immediately, and looking at the events that you're facing, and then, based on your analysis of audiences, etc., then also inform the public. And that's also, a way of just, I think, being transparent and also showing visibility, and that you actually also empathy, because when you communicate based on behavioral insights, I think it really shows that it's a bidirectional communication that we're talking about here. And then lastly, about monitoring public opinion, I think this again, I just mentioned, shows empathy, impartiality, etc. Next slide, please. And then I just very quickly want to go into key messages for COVID-19 vaccine introduction rollout from a communication perspective. Next slide, please. So really, I think more than ever before, people are looking at the whole immunization program and the whole rollout and the whole introduction. Before, people didn't necessarily always, I think, see all the necessary and complicated steps that go into actually smoothly rolling out the introduction of a new vaccine, but rather just sort of, the end stage of it, the administration of it. But now, the media is on logistics, on cold chain, on suppliers agreements, procurement agreements, everyone's informed. So this is also why, in terms of acceptance, a holistically strong program is definitely a motivation and a driver for vaccine acceptance. While, a weaker program and sort of maybe inconsistencies also in the communication of some of these elements may represent a barrier in acceptance when it comes to COVID-19 vaccines. Next step, please. Also for safety events, because, all eyes are on everything that's happening at the moment. And because we're dealing with new products, we're dealing with new vaccination spots, we're dealing with, different products potentially at the same time, syringes, diluents, manners of reconstituting vaccines, cold chains, etc. It's really crucial to also have a very rapid, coordinated and impactful response to whole, vaccine safety monitoring and surveillance in place. And I know that Dr. Pastor is going to speak to that also later. So the key message is, again, just having a very strong program in place. And also here, I think it's important that the perception of events may actually be higher than the events themselves, but people will try to, also interpret what's happening as sometimes their own perception of events. Next slide, please. Yeah, and then lastly, just really, and that, refers back to the hesitancy spectrum that Maria Paz also introduced. It's really important, I think, with communication is to try to target the middle and the very left, so the very accepting part of the spectrum. As the very sort of, anti-vaccine is thankfully mostly rather small, but they have, strong voice and voice their concerns. It is really important that we focus on the big chunk in the middle that either is not, accepting yet, or still has preoccupations, or still has some doubts about it, but that may be through, knowledge management, or really the transparent information sharing, can be convinced to then demand the vaccine equally. And I think also an important point here is really about, healthcare workers that are the champions of this entire, pandemic, but also really of the COVID-19 vaccine introduction. And it's also because they play multiple roles. And I think from a communication perspective, it's important to cater to their roles a bit separately, because we see them as the ones obviously, you know, receiving the vaccine now in the first round as prioritized groups, but we also then see them as those, you know, administering the vaccine and those who are the champions of vaccines. And they may, you know, react differently when they administer the vaccine as opposed to when they're the actual recipients of vaccine. And they too may have to, you know, they also may have some questions and some doubts about it. And Maria Paz said it, I think, brilliantly earlier. It's really, you know, about also taking into consideration that risk perception gap and the biases and how people make decisions from a psychological point of view on vaccination. Take this into account. And also use the social listening and use the, you know, information gathering mechanism also with healthcare workers. I think we should really try to, specifically in this pandemic, go away a bit from, you know, the general population and really try to identify separate audiences and then develop tailored materials for each of the needs of these audiences. Maria Paz, I think that's the last slide. I'm not sure if there's any burning questions in the chat.
There's a couple of questions. First of all, thank you, Katarina, for an excellent presentation. I enjoyed very much. And I'm going to share with you an excellent question that is in the chat and a suggestion that we've received. The question is a very technical one, but a very good one. It says, what is the best way to address substandard or falsified COVID-19 vaccines utilizing risk communication strategies? I think it's a very important question. I think we have to use every tool that we have shared with you. First, the suggestion is be the first to communicate about this, open bridges with the community, talking about this from the evidence point of view, sharing that there's risks involved in the using of these substandard or falsified vaccines, of course, and listening to the communication, listening to the population also. Why are they using this? Why are these vaccines on the public? So be very, very timely with the answer to those persons. I think that would be my answer. I don't know, Katarina, if you want to complement that.
Yeah, the only thing that I wanted to maybe mention, because I just also see it in the chat, and I do think we have to really use, you know, all different population groups when it comes to communication about COVID-19 vaccines or vaccines in general, because we also know that these population groups interact with each other, right? And so I think there it's just important that maybe the original messages go out in a tailored fashion to each of the population groups, but then obviously they would share this information, you know, with each other. And we've seen scenes also of, you know, grandchildren of you know, grandparents that were vaccinated. They helped them fill out different surveys, etc. So we do see this, but I think that the a priori approach should be quite tailored and really segmented in different audiences, specifically also because we know once the information is shared, trust is extremely important, and a lot of the decisions on vaccination are actually taken based on peer approach. So what your peers say, what your peers think, what your health worker tells you. And we do know that healthcare workers, and many studies have shown that actually are the most trusted source of information on vaccination, immunization. And I think we should really utilize this. And maybe before going to the little training session or case study that we have, I just want to say, I think, this is a unique opportunity, and we should utilize this in a positive way to raise the awareness of the importance of vaccination, of healthcare workers in administering these vaccinations, and really utilize this moment as an opportunity to strengthen healthcare systems, to strengthen primary healthcare, and really to use it, as an opportunity rather than a big challenge. Next slide, please. So in a similar fashion to the first little exercise that we had, we're now going to look at another exercise that focuses a little bit more on the power of, let's say, the news, as opposed to looking at AEFIs, because we felt that, you know, the manual really targets all kinds of different events that may erode trust in vaccination. And so we decided to do it a bit differently in the second case study. So the sort of case goes that COVID-19 vaccine procurement is conducted in country A, and during the planning phase of COVID-19 vaccine introduction in country A, you are notified and you are part of the National Communication Task Force on COVID-19 vaccination. You notified that the bilateral agreement with country B to procure a certain amount of doses has been successfully signed and endorsed. And the case description goes that, however, on the next day, a well-known and well-read local newspaper publishes an article criticizing the product to be of low quality and low effectiveness as it was produced in a certain country. Next slide, please. And then we can see quickly what happened in the local newspaper. And its concern about the quality of the vaccines that would be arriving in the country increased when it became known that some of the shipments correspond to the Povovac vaccine manufactured in the Artoska and Kolechia republics after the bilateral cooperation agreement signed last year. The quality of these vaccines is being questioned after a report that examined the manufacturing conditions, so on and so forth. That's the article that you've received. And now we can go to the last slide, please. So you receive a notification 2 hours after having been notified about the article that hotlines established at the Ministry of Health start receiving hundreds of calls expressing concerns regarding the procured products. And on social media, also some influencers get quite busy and start posting about not having the intention to get vaccinated should this product be used. The impact level is quite high because given the impact this event may have on the level of trust in vaccination and the authorities delivering them in your country, you wish to take action immediately to restore trust and ensure smooth rollout of the vaccines in your country. Let's please go to the poll, Fernando. So really here we only have 2 questions, but there may be a bit longer. So it's about the key messages that you would like to share with the public. Is it to downgrade other countries does not correspond to the behavior of intelligent people? COVID-19 vaccines are safe and effective. They have been approved by the NRA. All COVID-19 vaccines introduced in this country have passed rigorous clinical trials looking at both safety and efficacy to protect against severe COVID-19 infection and death. We have to understand that the population may be concerned. However, we can assure you that we will communicate in a transparent and open manner and will share the safety and efficacy data with the population. The vaccine procured is safe and effective. Or lastly, every medical intervention bears risks. The population needs to simply accept this to end the pandemic. And then as a second question, we wanted to quickly look at which communication channels you would use to disseminate this message. And it's either, you know, the local newspaper in which the article was published, television, newspapers, radio, social media, or official website of the government and other trusted sources. We'll give you maybe 2 minutes to fill out the poll. Fernando, what's the status quo of the poll?
It's about the 45%.
Okay, maybe let's give them another minute because the answers are quite long. think maybe in the interest of time, because we have one more panelist to go and 10 more minutes, maybe we should look at the results. Yeah. Yeah, I think this is great. I think what's really important here is that there's no real, true and totally false answer. I think with some of the key messages in the first question, it's really more about the phrasing and the use of language as opposed to the actual content of the question. And then again, yeah, I think specifically, with the communication channels, obviously it's very important that the government website's always up to date and serve sort of as the main communication and information source in the country. But I think there's also many other channels, and it's important that they're used in the right way, again, based on, behavioral insights and an understanding of the knowledge and attitudes and perceptions of the different population groups. Maria Paz, would you like to add anything?
I think we are very good in the time frame, and I enjoyed very much this poll, very agreeing with your interpretation also of the answers. So very, very interesting movement on the chat also. Maybe some of the questions are going to be answered after this webinar. We can give them some, these record presentations are going to be already in the PAHO website, but we can also share some of the question or the answers to the question that we're not going to be capable because of the time frame. But maybe we can go to the final presentation to respect the time frame.
Yeah. But yeah, as Maria Paz said, we'll do our utmost to respond to the rest of the questions that are left unanswered. And without further ado, it's my big pleasure to hand the floor to Doctora Desiree Pastor, who will introduce you to some of the very interesting and great tools that are available at the regional level. Over.
Yes, thank you so much, Lauren, Maria Paz, and also Katarina. I think that your presentations have been amazing. I think that everything is clear. I think that it's very important also to mention to all the participants what PAHO is doing regarding the tools to strengthen the global and regional surveillance of AEFI, the adverse event following immunization. So in the context of the introduction of the new COVID-19 vaccines, the vaccine safety component is very important. So, and therefore we want to show you what PAHO is doing to strengthen the surveillance of these events following immunization that could be associated with the new COVID-19 vaccine. So the next one, please. Okay, PAHO has been working through a group of more than 50 experts to define a regional surveillance system for ESAVIs, as we call in Spanish, the adverse event following immunization. The purpose is to develop a regional ESAVI surveillance system that is sensitive, timely, standardized, which means that all the countries have to be in the same page, listening and discussing about the same concepts, trusty, because we need to be transparent about the information that we receive, integrated, because many actors will be involved in the surveillance of ESAVIs, and with the collaboration of all these actors on vaccine safety, we will maintain the trust on vaccination and the acceptance of immunization in our region. So the general objective is to contribute to the timely detection of an appropriate classification of serious ESAVI and risk signals for the generation of a fast and appropriate response at the national and regional levels. Of course, we are very interested, as my colleagues have said already, maintaining a high degree of trust based on constant feedback on the safety of COVID-19 vaccines in our region. And it's important to mention now that although this system is going to be released with the COVID-19 vaccines, it will also include all the AEFI related or associated with all the vaccines that are used in the national vaccination schedules in the middle term. The next one, please. In this diagram, I want to show you specifically some of the tools created by PAHO that we can highlight. For instance, you see in the number 1 is the creation of maps and dashboards of the management risk plans that the countries are carrying out before the introduction of the COVID-19 vaccines, as well as an interactive dashboard with data about the characteristic of the COVID-19 vaccines that are in clinical trials now, and specifically those that have been already approved by a mechanism of emergency use and are being applied now in the countries. The second tool, you can see easily here in the second place, the Global Manual for COVID-19 Vaccine Safety Surveillance that WHO published in January of this year. This is the reference document globally used to guide on how to monitor the safety of these vaccines. And also the PAHO Regional Manual for the AEFI or ESAVI surveillance that contains the basic concepts and definitions for safety surveillance for all vaccines, including the notification and investigation forms that countries should consider as fundamental tools to achieve a final causality assessment and the final classification of these events. In the third place, you see that other very valuable tools that will be available very soon, that will be online, an online course with the modules of the regional manual for health workers to be trained in all critical aspects of ESAVI surveillance. So in addition, we will have sub-regional virtual workshops that will be held in the first quarter of 2021. In fourth place, you see other tools to generate knowledge are the studies of the ESAVI through our regional sentinel sites as part of our regional sentinel surveillance network that PAHO will convene in early March, and a study of monitoring cohorts of vaccinated people such as health workers and older adults that will be in place in March as well. So fifth, you see a regional committee for safety surveillance will also be convened by PAHO, which will be a highest and scientific advisory body to collaborate in the analysis of scientific evidences in order to generate reports with clear recommendations on the safety vaccination of the COVID-19 vaccines. Additionally, and very important, our PAHO's strategic alliances, working with technical and scientific partners, along with the social communication strategy that you already have seen in the previous presentations, and all the materials in social communication topics that we already have been shown and are important tools to maintain the confidence in the immunization programs. The next one, please. So I am going to talk about the available tools. The next one. And this is the picture of the WHO COVID-19 Vaccine Safety Surveillance Manual. So as I have said before, WHO published this manual this year, and this manual provides guidance prior to, during, and after the COVID-19 vaccine introduction. The target audience are the government authorities, the immunization programs, the national regulatory authorities of the ministers of health, and the manufacturers. In this global manual, there's a specific module for a COVID vaccine safety communications that is very useful to guide the social communication plans at the country level. You can see at your right in color dark brown, this is the color of the module for the COVID-19 safety communication. Next one, please. We also would like to share the guidelines to help to help health workers on the communication of vaccine safety, where they can find tips and other elements to help them communicate with parents, caregivers, and patients as well. So it will be a webinar. The tentative date is March of this year. And also, I would like to share the PAHO regional manual for the ESAVI or the AEFI surveillance that is soon to be published and contains a risk communication chapter as well. So the next one, please. So finally, I would like to show you that other COVID-19 publications have been done by PAHO. For instance, we have published some paper about the myth and rumors that it is important for healthcare workers to understand how to deal with that situation. The facts that the healthcare workers need to know will be also included in the guidelines. You see this new publication in the middle of your slide, the guidelines to create a risk communication strategy. This is something very new and will be very useful for the countries to use to create the risk communication plans as well. So I think that we have created many tools in different topics, and above this will be, of course, all the technical expertise that PAHO has in place through the regional level and also through the country offices as well. So thank you. We invite all of you to read very carefully all these materials and go on with all the strategies in place. Thank you. Over to you, Lauren.
Thank you so much, Desiree, and thank you to Catarina and Maria Paz for your presentations as well. And of course, to everyone for connecting today. We know you guys are all very busy, and so we really appreciate the time that you're taking to learn about this. And as I'm sure you've seen throughout the session, this is an incredibly important topic, and we look forward to collaborating with you on this. Please, if you have any further questions or you have any other needs, please let us know, reach out to us. We will be sending the link to the recording of the session, as well as the links. I see that we've put a few in the chat already, but we will also be sending these out along with the links to the recording. So we look forward to being in touch with you, and thank you so much. Take care and have a great rest of your day.